Ladies and gentlemen, I'm Jambo. I'm Jambo. Thank you so much. Okay, so let me join the previous speakers in welcoming you all, because this is a welcoming session to all this important gathering. It's also really a great pleasure for me to be here on behalf of the United Nations family in Kenya. We say it's the Jumuiya ya Mataifa. You knew that? Looks like you didn't. Huh? United Nations, Jumuiya ya Mataifa. That's what I am representing. And share some of our ideas in our contribution to the universal health coverage in the context of the Sustainable Development Goals. The World Health Organization that I represent recognizes the critical role played by the people and the government of Germany in providing important health and development services globally, but also in the African region, and also, of course, in particular in Kenya. Please receive the World Health Organization appreciation, and of course, as part of the United Nations family in Kenya, allow me also to convey the appreciation from the rest of the United Nations agencies, especially those ones who are involved in health cooperation, and I would like to mention them for your records. That is WHO, IM, UNICEF, UNFPA, UNAIDS, the World Bank, UN Women, and they are now known as H6. And of course, the entire United Nations system, the country team as a group largely, and UNDP has been supporting in terms of governance. OCHA is the Secretariat for Emergencies and Humanitarian Actions, and among others, UNEP, UN Habitat, the World Food Program, and so on. Let me commend the partnership between GIZ and the government of Kenya, and the importance it brings to the health sector as part of the health system strengthening. Ladies and gentlemen, after this welcoming, I would like now to enter in the second part of the title of this session, that is context setting. Let me use this opportunity to remind ourselves about the current health perspectives relating to the global health strategies, particularly in relation to how they have guided the countries in terms of defining its health agenda and to move to the universal health coverage, including here in Kenya. I'm sure that most of you should be aware that WHO has been strongly advocating, and the United Nations, of course, for a move to attain universal health coverage as the anchor agenda around which the health sector needs to be built in the post-MDGs, the global development field. We are talking about the Sustainable Development Agenda adopted, the SDGs adopted last year in New York in General Health Assembly. We are fully aware that many countries in the African region, including Kenya, the health targets, they were known as MDG 4, 5, and 6, were not fully achieved. Hence, the need to deal with them as unfinished business. I think that it is important at this forum to remind ourselves of the historical background of the universal health coverage agenda. The health services in many of our countries in Africa have evolved through different phases, since our independences. And each phase was characterized by successes, but also by some failures in the attainment of the desired health goals. So Kenya is part of that. We are talking about the Kenya 50 has gone also through those phases. The health focus has evolved significantly since independence in line with the global paradigm phases of health, and we as WHO, we have characterized them in mainly five distinct phases. The first one, which we have called the expansionist phase, corresponded to some reforms in the 60s, 70s. That was the post-independence phase. Healthcare was relatively free and easily accessible, but relied strongly on extensive investment in the health sector by the government. It is easy, of course, to understand that there was sort of facility-based healthcare delivery, which is not holistic. And we cannot ignore that health starts at home, at community level, and not at facility level. This phase ended with the global recession, as we know, around the 70s, and then we entered the second phase. As a result of this global economic crisis during the 70s, access to capital decreased, making the health system design really unsustainable. And as a result, there was really either reduced or even stagnant investments in the health systems, and health services deteriorated, with most public health programs collapsing and health facilities facing shortage of everything, human resources, medicines. And during this second phase, the quality of health services really declined. And we had the table payments become prominent, and of course, especially in the African region, there was more resurgence of the use of traditional medicine as first choice for care. During this time, the global focus on health shifted from hospital focus to what we know as primary health care approach. And you also remember the Alma Ata Declaration in '78 that promoted combined medical and social goals being addressed to the client. Okay, so we are now in phase 3, third phase. The countries as health services therefore were in the third phase, the PHC adoption. Community involvement and participation plus better sustainability of health services were further championed by, in the African region, by the African ministers through what is known as Bamako initiative that was adopted in Mali in '87. So by that time, this phase was therefore characterized by targeted focus in key interventions that were deemed as most important or cost-effective. The user charges became a mainstay in service provision, and there was also the element of cost recovery. So we are now entering. Now let me enter in the fourth phase. It's not the last one. We are in the fifth now. The health sector entered on the first reform phase, which we call a PHC re-engineering, and this was characterized by significant increase in external support. I think that's when GIZ or GTZ or all those came in. The Global Fund, the JICA, the UK, the CIDA, CIDA Canada, or CIDA Swedish, and others, focusing on emergencies and targeted diseases like the Global Fund targeting HIV, TB, malaria, and also this coincide with Millennium Development Goals, and also coincide with the end effectiveness of Paris Declaration. And however, the system was still too costly and heavily donor reliant. In addition, local priorities were not adequately taken care of, as the focus of and investments were largely determined by the central ministry, the national government, and a stronger emphasis on the role of good and coordinated health system was missing. And I'm happy that Dr. Elizabeth brought us the element of coordination and the different intergovernmental coordination mechanisms that were missing in this phase that I'm just describing. So we are now in phase 5th. And in the case of Kenya, let me come down to Kenya. The promulgation of the 2010 Constitution marked the beginning of this 5th phase, the current phase of the system. And this is being driven by the need to better involve the population, better involve the communities, and determining health priorities through the evolution. and implementation of rights-based approach that looks at health as a right, not as a luxury. This phase is also characterized by a government that is increasingly taking charge of its health agenda. And regionally, we are talking about the Ouagadougou Declaration, for those who attended the Ouagadougou meeting, where the linkage between the health systems and the delivery of service were really stressed, and the countries in the African region are really adopting that. And globally, this phase has been also driven by an increased emphasis on health systems approach to implementing the PHC and move towards the universal health coverage. The current phase of the health sector is therefore in line with the overall global focus for health, and this is best encapsulated by the proposed overall health goal that talks about ensuring healthy lives and universal health coverage at all ages. The global health strategy approach is built around I would say, 4 main guiding principles. The first of one is, it was by that time related to the health-related MDGs, focusing on ending preventable child and maternal deaths, plus the epidemics of HIV, AIDS, TB, malaria, and other communicable diseases. The second addressed the burden of non-communicable diseases, injuries, and mental disorders. Dr. Pacifica, can you hear that?
Yes, yes.
Yes, because both of us, we are psychiatrists, so we cannot make a statement without talking about mental health. Through a focus on reducing premature deaths and disabilities from non-communicable diseases, injuries, and mental disorders. Achieving the third one is achieving universal health coverage, which includes financial risk protection through a focus on assuring universal access to defined quality health services, while also, as I said before, assuring financial risk protection. And the last one is to address the social and environmental determinants of health through focus on reducing exposure to environmental risk factors, improving nutrition and health security, so. I think I will really say that the focus of the global health strategy is very much innovative in a number of ways. The first thing is that we are shifting from a focus on diseases to a focus on individuals, ensuring that health of the individual is quite noble, places the individual at the center of our efforts of the health sector, and makes sure that health is addressed holistically. Secondly, the strategic approach places emphasis on a healthy life and aims to address all physical, mental, and social components as per the WHO Constitution. And it is only when we can maximize the amount of healthy life that we can maximize the capacity for labor force and participate in development. And in fact, I used to say that there is no development without health. Thirdly, a focus on universal health coverage with the required services is central to the current health strategy. By focusing on universal health coverage, we are trying to ensure individuals have access to all available services that will assure their health needs, and they are able to use these services in a manner that does not lead to financial catastrophes. And finally, a social determinants, well, we're talking about housing, water and sanitation, agriculture, labor, and so on, to ensure that health is looked at, from all those dimensions and is embedded in all government policies. So the World Health Organization, together with the other United Nations and the development partners, have been engaged with the Kenya government to ensure that health agenda takes this current global health focus in mind, all what I have described, while defining their health priorities and embrace as part of post-2015 agenda, and I'm talking about the Sustainable Development Agenda. We are using our instruments. In the case of WHO, we have the WHO Country Cooperation Strategy, but as United Nations, we have the UNDAF, and also in the context of evolving partnership, we have the DPHK, civil society, etc. We have pledged support in a number of areas in line with the health priorities defined by the National Health Strategy 2014 and 15. And I'm not going to go the list of things that we are doing, but I think it's important also to indicate that we are very much also in health system strengthening. We are very much in supporting the government on resource mobilization, and I would say that in capacity building, in strengthening referral systems, in reproductive health and maternal health services, in social health protection, in health financing, in support to quality care initiatives. So, and this partnership with GIZ is built on a solid global foundation. It's possible to have quality health as a right. And as I conclude, let me reiterate our commitment, the United Nations Family commitment, in making Kenya a better place to live, a healthier country. Asanteni sana.